Hi, Dr. Rudy Kachmann. Welcome to our show. This episode here will be on stopping, preventing, reversing type 2 diabetes. Very important show because type 2 diabetes has associated with it about 50 to 70 illnesses which can be totally avoided. Yes, totally avoided. One of the biggest ones, let me review the complications of especially type 2 diabetes. We'll discuss the difference between type 1 type 2 shortly. But things you can get if you develop diabetes is so common. 1 out of 2 people in the nation is pre-diabetic or diabetic. And all these complications I'll be speaking about here in a minute can occur in pre-diabetes. A lot of people don't realize that. Many people have not received the correct tests. They'll get a fasting blood sugar, but that's not enough. You need more testing than that to catch it very early. Then if you lose 8–10% of your body weight, it's gone. Or eat the right way, which I'll teach you easily. So what are I just named some of the chronic long-term diseases associated with type 2 diabetes. Blindness, all type of eye symptoms. The most common cause of blindness is complications of vascular disease from diabetes, the small vessels in the retina especially, increased rates of cataracts, for example, hemorrhages into the eye, and visual field defects. I had a friend of mine who recently lost part of his vision, a big-time tennis player, because of vascular disease, strokes, dementia, memory loss. This is a big one. The biggest cause of, quote, Alzheimer's disease, dementia, 70% of dementia is caused by preventable diseases. 30% are not preventable, but 70% of the are. And most of Alzheimer's disease dementia is caused by type 2 diabetes and its complications. It's been now scientifically proven. Yeah. And an excellent book to read on that, the proof of it. There are many books, I have many at home, but I think this is an excellent one. I'll hold it up for you. I met these 2 lovely people, man and wife here, great to read. And Dean and Asha Sherzai, they're from Loma Linda in California. I'm going to visit them in a few weeks. They invited me to come on their board. And what I like about this approach is if you follow what they recommend to avoid dementia, you won't have diabetes, which they consider one of the main complications, and there's 50 diseases. Yeah, not that hard either. I mean, they're speaking about proper nutrition, nutrient-dense way of eating, 70–80% of the time maybe, nutrient-dense foods of color, maybe organic meat, 1 or 2 twice a week, that's about 8. But big-time meat eaters, they mentioned too, will cause insulin to go up, which help cause dementia. And the reason dementia occurs in this is that when we have insulin resistance, and which is the cause of type 2 diabetes, is that when we eat a lot of sugar, sugar's the cause. It isn't fat, it's sugar. That's the cause of it. Sugar gets converted to triglycerides of fat, and that hits these receptors which are on the surface of our cells. And the insulin is supposed to take the sugar and put it into the cell for energy, but because the triglycerides are elevated and these receptors are full of fat, that's insulin resistance. Rarely meet a patient who knows what insulin resistance is, and it's because their provider has not taught it to them. And because the blood test you should run then is the blood sugar, which, so 90 to 126 pre-diabetes. The figures vary a little bit, 126, you get diabetes. HbA1c, sort of a maintenance test, but can also be a screening test. That checks your sugar for the last 2 or 3 months. Okay, if it's a 6.4, you're diabetic. Some would say 7, but 5.6 6 or so to 6.4 or so would be prediabetes. And remember I said the complications can occur in prediabetes, so you want to make sure that your HbA1c may be under 5 or so, okay? A lot of truck drivers going down the road, the federal law says you can't drive a truck if your HbA1c is over 8. I mean, how ridiculous, frankly, because the blood sugars between 7 and 8 are extremely high. And the truck driver may be dizzy or have memory problems. For example, from eating truck stop food, and the blood sugars now may be 300 or 400, but the 3-month one, they can drive a truck if it's under 8. I mean, that's federal law, should be 7, but then we wouldn't have many truck drivers, and that could be a problem. But again, our safety, I think, is important. Let's go down the line. Dental disease. Queen Elizabeth, for example, had black teeth from eating. She could afford the sugary foods, while the rest of the population was eating about 5 pounds a year. Now we're eating 200 pounds a year. Remember, it gets converted to triglycerides, which causes insulin resistance. So when you get blood testing done, be sure to get triglycerides. Heart disease, very common. They just grab your chest and die. That's how 50% of the people with heart disease die. No symptoms, no angina, no pain, nothing. Boom, you're dead. Occurs a lot. So half the heart attacks in this country occur in prediabetes, and diabetes. They occur unannounced, okay? No symptoms, no angina or warning of some kind. Liver disease, renal disease, kidney disease, about 80% caused by diabetes. Extensive vascular disease, the whole body. Amputations, a dime a dozen of them are diabetic. They'll cut off a toe and it won't heal for a while. They'll cut up a toe, then the ankle, then the lower leg, then the upper leg, and they may even do the arms. Yeah. All preventable by proper testing and then acting on it. You have to act on it. Well, you know, you weigh 250 and your blood sugar is normal. You don't have diabetes. Baloney, baloney. The testing I recommend is serum insulin. Because remember, we talked about the receptors and the fat on them. The blood sugar may be normal because the pancreas has been working like a dog, secreting insulin, more insulin, more insulin. And if you check for the insulin level, it'd be elevated. So a patient today had a normal blood sugar, but elevated serum insulin, 8-10% weight loss, insulin would be normal, diabetes go away. You might say, well, I'm cured of my diabetes, the blood sugars are normal, I can eat what I want. No, you'll be right back where you were because the body will react the same way. You develop insulin resistance. Let's use me for an example. If I were to, say, go to a fast food restaurant, eat nothing but that food, and there have been, you know, previous shows and movies about that, not me, but where a guy went to McDonald's, I think it was, and ate all the food for a month, or whatever fast food restaurant it might have been, and became diabetic, and when he ate somewhere else, healthy food, it went away. Is he cured of diabetes? I mean, my point is, if I were to go to a fast food restaurant, say, any of them eat foods that's been stripped of all the nutrients for a month, would I be a diabetic? Odds are, and if I start eating right, it'll be gone. So do I have diabetes? I say, if your figures have returned to normal with proper lifestyle, you don't have diabetes. And I think you could almost take any person, give them wrong food for the month or two, they'd be diabetic. I bet 90% of the people. That's just my own thought on that. So to use the word cure, I wouldn't use that. Keep the right habits. So hip arthritis, knee arthritis, impotency is common in males 3 months before they get diagnosed. Hypertension can be the first symptom for diabetes most of the time. You get high blood pressure, I want to know if I'm diabetic or not. I want a glucose tolerance test, and that would be the proper testing. I give a handout to people, and I'll hold it up for you a little bit. In the back are the complications, which I sort of skimmed over, okay? All right. if you come to the Three Rivers Pharmacy in Fort Wayne, where I give free counseling on Friday mornings, which I did today, the Three Rivers Pharmacy. Sheila Walker there will answer your phone and schedule an appointment to see me. They also play my YouTube shows there. Like this morning, patient comes in, wants some medication, and she'll say, you want to get rid of your disease? See, most medical care today, script to the ill, script to the ill. And I say to that, let's try prevention first. If in a month you don't improve from habits, which I'll teach you, then you may need a script, okay? Metformin, insulin, things that we may need. But the problem with insulin is if the other medications don't work, it's antibiotic. It makes you gain weight. That makes things worse. It stiffens your arteries, increased rates of cancer, helps cause dementia. You know, I showed you the dementia book, and it's kind of interesting. What happens is, if you have prediabetes or diabetes, the brain lives on sugar, okay, most of the time. It can live on fats if it has to, but it's mainly sugar, is that when the insulin level is up, and insulin is trying to push sugar into your brain cell, eventually the insulin has to be degraded and get rid of it out of the body, okay? And the brain makes an enzyme called IDE, IDE. The IDE is used to get rid of the insulin. Okay, it does that. It's all used up because your insulin level is up. Guess what the other job of IDE is to get rid of amyloid and tau. Those are the proteins that cause dementia. They block the nerve sheaths, and the tau goes right inside the cell and interferes with the flow of the electrons. So the IDE is used up, getting rid of insulin. None is available to get rid of amyloid and tau, and you get dementia. That's why it is thought that diabetes, insulin resistance, is a cause of the majority of dementia cases. So Rudy's good news. What's the good news? Eat right, no diet, nutrient-dense way of eating, 70, 80%, foods of color. You can add mushrooms, onions, meat maybe no more than 1 or 2 days a week. Exercise a bit, take a walk every day, dance a little, take up tap dancing like I do, or whatever you consider to be fun. Exercise a bit, but that's about 20% of it. 80% is the type of food that you eat, okay? Type of food. And let me tell you the difference between type 1 and type 2 diabetes. Type 1 is where the pancreas doesn't work any longer. That's what it was years ago, mainly virus or bacteria. It is also thought and scientifically proven that milk has a lot to do with that. Yeah, milk. Don't believe me? Read a book called Whitewash by Joe Keon. Joe Keon. Every person, at least every mother, should read that book. Once you read that book, if you give your kid milk, I'll be surprised. Full of scientific references. Full of scientific references. I read it 2 or 3 times, and it's shocking because the government and the industry has promoted milk upon all our children. Once you read that, if you drink milk, I would be surprised. Maybe you don't know how to read, but I gladly discuss it with anyone. So it is thought that milk increases rates of type 1 diabetes. Also gluten. Get a gluten test. A lot of people don't tolerate the gluten from wheat, for example, and in other products. And they have celiac disease, 1%, maybe 10% are gluten sensitive. They're sensitive to it. Only certain foods would do it to them. So you get genetic testing or blood testing for gluten. I think it's important. It's underdone big time. A lot of people have strokes, dementia. A lot of the symptoms are outside the gut from gluten. So to be open-minded about it. Don't be so resistant to test it. I had a banker's lady. She was my banker, and she was complaining to me about knee pains all the time. And I said, get a gluten test. Young person. And I didn't see her for 2 months. About a month later, I didn't see her. Finally saw her again. I said, what happened? She says, well, Dr. Kachmann, I made a mistake. I said, why? She says, you said get a gluten test. You know what happened? My doctor sent me to a rheumatologist, and the rheumatologist started me on steroids for my joint pains. Well, it's one of the side effects of steroids are, of course, weight gain. Another is it can cause aseptic necrosis of joints. She lost both her hips over it. Had hip operations. That's why I didn't see her. Then I said, well, did you finally do the gluten test? She says, no, I believe you. Start eating right, avoided gluten, and guess what? All my other symptoms, my mind symptoms, my memory problems, my joint problems all went away. But now she has 2 artificial hips. And, they can have problems down the line. Isn't that interesting story? So that's this one-page thing is available at my lectures that I give once a month for Lutheran Hospital. You can go to Facebook, see the date and time on there. Facebook, Kachmann, Live to be 100. Facebook, Kachmann, Mind, Body, Spirit. Mind, Body Institute is another one. And you can find out the dates. And you can get one of these for free, or go to the Sheila Walker's Pharmacy, 3 Rivers Pharmacy, end of North Anthony by Concordia High. You can get it for free there too. And I will see people there on Friday mornings for free who want to stop, prevent, reverse diabetes. I did this morning. Also some cancer prevention. Also to get rid of addictions. I see a lot of people that no charge. That's just my purpose. It's what I do. And so in testing, I tell you honestly, a belly measurement, the hip abdominal measurement, especially in women, very accurate. If your belly's bigger than your hip, for example, it's the ratio, like I think it's 0.85 supposed to be. A pot belly can mean pre-diabetes or diabetes. Very accurate. Rarely do I see an exception, occasionally, but most of the time, a belly measurement is almost better than a blood test. BMI, body mass index. If you're 25 under your normal, to 30, overweight, 30 and over, they would say obese. But remember, they're the trophies. They're thin on the outside, fat on the inside. They're fat in the liver. They can have diabetes and abnormal blood tests too. So it's not always the way you look. It's your blood tests that count. It's your blood tests that count. If you develop high blood pressure, watch out for diabetes or pre-diabetes. Extremely common. 2-hour glucose tolerance tests are like the best, where you fast overnight, which most of us do anyway. And then they make you swallow 75 grams of sugar. And before that, when you do that, you took a fasting blood sugar and a serum insulin. Then 1 hour fasting blood sugar, serum insulin. Then 2 hour fasting blood sugar, serum insulin. You'll catch diabetes very early. In the early stages, the blood sugar will be normal, but the serum insulin is elevated. And it goes throughout 5 stages. Down here on the sheet, I have Mark Hyman's method of testing it. Mark Hyman, Hyman, good books to read. You can also look at his website, How to Speak to Your Doctor, 70 pages. You can print it off free. I think it's very accurate and explains this very well. And we are diagnosing people at stage 4 diabetes usually. At stage 5, amputations, blindness, nursing home, death. So once you catch it, at least stage 1, you lose 8-10% of your body weight, diabetes gone, not hard. And this happens quickly. When you eat, you're educating your biome of your body. That's your gut. We have trillions of bacteria live in our gut, and they help digest our food. But those bacteria, one at a time, die in 20 minutes. So if you eat the right food, you're re-educating your biome. quickly. Mark Kachmann says you can start to get rid of your diabetes in a week. You know, you wonder about a week. Now they read a lot about the biome. I wonder a few days if you're feeding your biome the right food, because these trillions of bacteria in there which regulate your body, they change quickly. They change quickly. And you can get rid of diabetes quickly. So to me, you used to say what your blood work is. Nah, you actually are what your biome is. It's just blood work is easier to test. Although they can test your stool and determine what your biome probably looks like. And so Mark Hyman we spoke about, Blood Sugar Solutions, good book. Another person I like a lot is End of Diabetes by Dr. Furman, Joe Furman. He's come to town, incidentally, September the 15th, 5 to 9 at the First Assembly Church. He said he would not come to Fort Wayne unless he could stay at my house. I picked him up at the airport, I think, on Friday night at 9, and then he said at 9 a.m. I want to play you tennis, Dr. Kachmann, because I beat him the last time. Yeah, I got plans. And then at 12 o'clock he gave a lecture at the First Assembly Church. Excellent, excellent. And what he teaches, nutrient-dense eating. He's right on the money. It's what I teach. What I'm teaching is no diet. Eat nutrient-dense food, fruits of color, add some mushrooms, onions, especially beans you speak about. No more meat 1 or 2 days a week, and make it organic meat. You'll be rid of your diabetes a few weeks, a month off medications, most of them, not all of them, most of them. So tell your doctor, this is what I'm going to do, because your blood sugars will drop quickly in 90% of the people. This was New York Times bestseller list for 2 years. And my name's back of the book. Yeah, my name's back of the book. I didn't help write it, but I reviewed it, and he put my name on it. We thank him for that, and I'm going to beat him on tennis on the 15th. I promise you. If I lose, I won't announce the score on the TV. No. Another great book to read would be Goodbye Diabetes by Wes Youngberg. I also met him at Hilton Head, visiting my daughter there, and I staying at the Sonesta Hotel, and who's giving a lecture there with the Amen Society, which go over the world, teach people good health, dressed in their native garbs. You couldn't believe it. And what happened to him was the island of Guam was flattened by the Japanese, because those beautiful natives, I've seen pictures of them in the book, who ate nothing but vegetables and fish, because that was destroyed by all the bombing. American food came in along with Spam, and they turned the whole island into diabetics. Yeah, that's a picture of them too. They weren't as pretty, most gorgeous natives you ever saw. And his judgment-free zone is just what happened. And became type 2 diabetic. So he devised a method of testing, which is used by Kaiser Permanente, HMO in California and a few other states. He puts the diabetes in stages 1 through 5. Like stage 1, high blood sugars 85 to 94. So you used to think, well, that's not so bad. Well, you're on the path, you're on the road to diabetes. Stage 2, 95 to 99. When the president was running the primary, this was in the newspaper, he had a blood sugar of 99, he weighed 230. So what do you think? He's stage 2 high blood sugar. Last time that he had a physical last year, I think he weighed more. The doctor didn't want to tell us the sugar on the TV. I noticed he doesn't work on there right now. And eventually stage 4, pre-diabetes, 110 to 125, and stage 5, at 126, you have diabetes. So you can, if you put this in your computer or in a book, you can see the path of your blood sugars, and if you're a good physician assistant, nurse, or doctor, you'll have this on your patients or on a graph in the chart. You can see the path and catch them early, teach them a little exercise, a little weight loss. It's gone. Yeah. It's gone. And as long as you keep your good health habits, it probably will never come back. So it's a great story, you know, great story of hope. But you must act. You must act. You can't just listen to this and live in denial and delusion and not change, okay? And so let's summarize the whole thing a little bit. And before I start on that, here's a book I read by Tanya Ish-Kaler, The No, Drug Success Story That Keeps Getting Better Year After Year. This gentleman did what I just said, and he's maintained this great habits. It's also an excellent book to read. A patient's story. That works. I personally know many people who've lost their diabetes because they did what I asked them to do. It's not hard. Sugar's addictive. Nature designed in us a addictive circuitry. Sugar's a quick fix. Releases dopamine. I'm in heaven. Eating a donut. I'm in heaven. And but to get rid of diabetes, you don't have to be 80%. You just do 70, 80% what I said. Because who wants dementia? Who wants his legs amputated? I've been to a church funeral recently, and I say 3 family members had their legs amputated. Mm-hmm. They were living in denial and delusion. I told them about what the problem was in the family, but they're living in denial and delusion. This is common. Nature designed us things to make us feel good, and I think maybe they felt the stress. So in summary, if you want to get rid of your diabetes, I'll give you a quick fix, okay? If this is your calorie burn, say in one day, about 40% is basic metabolic rate. It's the activity of your calories burned by your brain, your heart, your lungs, your liver, your pancreas, your muscles, doing nothing at rest. That's 40%. Hard to change that, okay? Then we have the thermic effect of food, the energy taken up by your food. If you eat mainly fat, you only 4% use up metabolism. It'll be on your buttocks, your belly, 4 hours, okay? Then the activity of living, AOL, which is where you park your car, whether if you stand up, you triple your calorie burn, taking advantage of gravity. You play a sport or dance or tap dance, let's say I do. So movement and vibration, which is picked up by gravity. So if you can increase your calories burned by increasing your activities at work, for example, I mean, maybe get a stand-up desk or treadmill desk or walk a lot. If you're lucky and work in a factory, you're walking a lot, lifting a lot, that's a great way to burn calories. So in summary, it's not that hard to get rid of diabetes. I want you to visualize yourself, stand in front of the mirror and decide this is what I'm going to do. And I'm going to get rid of this disease, which is associated with 50 or 70 illnesses. You can say goodbye to them. I have this program because I love you. If you need to see me at the pharmacy, pick up some of my free handouts. We care about you. That's why I do what I do. Sing me a song. Give me a hug. Buy me a cup of coffee, and I'll feel better right away. Bye-bye.